Good morning, everyone. Welcome to our program this morning. Today we have Lori Ramig, and Jennifer Tuccitto, who will be talking about LSVT Big and Loud. But before we get to them, I just want to introduce Ashlyn, who will be helping us out on Sunday morning. And Ashlyn is a graduate student at USC studying physical therapy, and she's interested in Parkinson's disease, and she'll be here to help out in the background and make sure everything runs smoothly. And do you want to say a few words?
Sure.
You can turn your screen off.
All right. Hi, everyone. My name is Ashlyn. I'm going to spotlight myself, so hopefully I will pop up on everybody's screen. Like she said, my name is Ashlyn. I am a second-year physical therapy student at the University of Southern California. And I just wanted to say hi. And like she said, I'll be in the background, hopefully helping with those technical difficulties if they all pop up. And I am so excited to be here with you guys. And thank you for letting me join in on your programs every Sunday morning. So if you have any questions, feel free to just shoot them in the chat or ask around.
Okay. All right, we can stop the screen sharing, and I am going to turn it over to Lori and Jenny, who will introduce themselves and talk about their program. And it's going to be, I think you're going to enjoy the program a lot this morning. So, spotlight me. Okay.
All right, rock and roll. Good morning to California and good afternoon from New York City, where I am. I'm Lori Ramig, Chief Scientific Officer and co-founder of LSVT Global, and we're delighted to be with you today. We're going to do a brief overview of LSVT Loud, the speech therapy for Parkinson's, and LSVT Big, the physical therapy. So it's very cosmic that Ashlyn is studying physical therapy. That's really, really great. We greet you from LSVT Global. Our motto is innovation in science and integrity in research. This is me, and next to me is Jenny Tuccitto. She's LSVT Director of Innovation and Communications, and she is an expert physical therapist in Parkinson's disease. Next slide. I greet you from New York City, Columbia University, also the University of Colorado Boulder, and the National Center for Voice and Speech, where most all of our NIH research was carried out. I've been the principal investigator on over 25 years of science. So we have a lot of great foundational research to support the treatments that we will be telling you about. Next slide. We also greet you from Tucson, Arizona, which is LSVT Global's global headquarters. And so you have many places to come visit us. Next slide. And Jenny greets you from, you should tell them, Jenny.
Well, hi, everyone. I'm Jenny Tuccitto, and I am from Stillwater, Minnesota, which is a suburb of Minneapolis-St. Paul, right on the Minnesota-Wisconsin border. So the picture in the upper left-hand corner you see is from my yard, and you can see the river. On the left side would be Wisconsin, and on the right side, Minnesota. So happy to be with you guys today. It's finally warming up a little bit here. I'm sure you guys have much better weather in California.
Great. So here are more details about us. I won't go through it all, but it does give you our background and establishes our credibility and our love for the Parkinson's disease community. And as we all know, April is Parkinson's Disease Month, and April 11th is National Parkinson's Disease Day. So we have so many exciting activities. Next slide. I acknowledge the research support we've had from the National Institutes of Health for over 25 years, as well as many other organizations and foundations. And we are very, very grateful for that support. We also disclose our relationship with LSVT Global. We are committed to enhancing quality of life in Parkinson's disease through efficacious-based interventions, which you'll hear a bit about today. Next slide. So the plan is to review speech and movement disorders in Parkinson's disease, talk about how you can improve your speech and movement with LSVT Loud and LSVT Big. I will highlight briefly how you can participate in Project Euphonia, which is a collaboration between Google and LSVT to gather voice data remotely from individuals with Parkinson's, and then we'll have time for some questions and answers. Next slide. So over 89% of individuals with Parkinson's disease suffer from voice and speech disorders. Reduced loudness, hoarse, monotone, voice, and imprecise articulation are among the classic characteristics. Some of these characteristics may feel familiar to you. These voice and speech disorders contribute to lifelong frustration, embarrassment, and social isolation. One of my patients in New York City said very poignantly, "If I have no voice, I have no life." Next slide. Speech and voice disorders in Parkinson's are very complex, and this is one of the reasons that speech therapy has never previously been effective. There are at least 3 reasons that people with Parkinson's have speech or voice disorders. One is the hypokinesia, or reduced amplitude of movement, that we see all over the body of Parkinson's disease. Jenny will talk with you about this in relation to LSVT Big, but the hypokinesia, reduced amplitude of movement, is also in the whole speech production mechanism. And that's one key element underlying the speech and voice disorder in Parkinson's disease. There's also a sensory disorder that occurs in Parkinson's, and often our patients will say to us, "No, I don't have a speech or voice disorder, but the whole world needs a hearing aid. Everybody keeps asking me to speak up. I think they all need hearing aids." And the bottom line is the person with Parkinson's disease does not perceive the volume of their speech accurately. And then third, there is an internal cueing disorder. Parkinson's disease results in the disruption of the internal cue, or the trigger for a movement. So a speech clinician, for example, can say to you, "Increase your loudness," and with that external cue, you can do it. But the challenge is to get you to self-initiate and internally set your trigger to increase loudness. And these are 3 elements of variables we work on when we do speech therapy, LSVT Loud, in Parkinson's disease. Next slide. I'd like to now show you an example of a patient with Parkinson's disease before and after LSVT Loud. The treatment is 16 individual sessions in 1 month. So the change you will see in her pre to post treatment is over 1 month of time, and she's had no medication changes, nothing else changed. So everything you see in terms of her speech relates to receiving LSVT Loud. And her name is Shirley.
Have you noticed any changes in your speech or your voice that you would associate with Parkinson's?
Yes, I don't speak loud enough a lot of times.
Anything else?
Hoarse.
Uh-huh. Anything else?
I stutter, which I never did before.
Do this for me if you would. Take a deep breath and say "ah" for as long as you can. Good for you. Okay. Would you say Parkinson's disease has caused you to talk less?
Yes.
Because?
Because I stutter and then I can't be heard. If there's noise in the house, like when the kids come over, nobody pays attention to it because they can't hear me. Till I get mad and then yell.
Take a deep breath and say ah for as long as you can. Have you noticed changes in your speech or your voice as a result of the speech therapy?
Oh, yes.
What have you noticed?
I talk louder. I think louder. I'm going to sing with the Sons of the Pioneers one of these days with my voice.
Good for you. That's excellent. What practicing do you do at home?
My ahs, my highs, and my lows. And I read out the mail out loud.
Excellent. Do you feel like practicing helps?
Oh, yes.
Okay. Do you feel as though people can understand you all of the time now?
Majority of the time, unless it's my husband, and he'll say, "What? I can't hear you."
Good for you.
But I think he does that just to be cute.
I think he does too. Has anyone commented that it's easier to understand you now?
Oh, yes. I set some of our friends back when we went to their house, and I talked loud. Lou says, "What the hell happened to you?" My daughter said, "Oh, Ma, that's you?"
Isn't that good? Don't you feel wonderful?
Oh, yeah, because now she can't say, "I didn't understand what you said."
Right? No excuses, right?
Yeah,
That's
no
right.
excuses.
All right. So what do you do when you want to be as easy to understand as possible?
Think loud.
Great. So Shirley inspires us every time we listen to her. And what you heard occurred, as I said, over 16 hours of speech therapy in just 1 month. Her voice got louder. Her quality of her voice, her hoarseness improved. She had better intonation. She had better facial expression. And it's really important to point out to you that she is not a rare outcome of LSVT. We have studied over 175 people with Parkinson's disease over the years, and this is a very nice outcome, but it's not unusual. It's so exciting. And what you could see is not only was it loudness, although that is the key element we work on, there was a spreading across this whole speech mechanism. And what you see in this slide is an example of the elements of the speech production mechanism. You see the respiratory system, the vocal cords, the mouth opening, etc. And pre-LSVT, typically people with Parkinson's have the scale down of the amplitude, the hypokinesia, as this gentleman does here. But when Jenny clicks the slide, you'll see what happens after LSVT loud. All of those elements of the speech mechanism get larger, more amplitude, they get scaled up. So as you saw in Shirley, she got louder, but all the elements of her speech mechanism worked better. What's really important is this is healthy vocal loudness, not vocal strain. Nothing bad happens. It's simply scaling up loudness and amplitude across the speech mechanism. What else is really important is we have published the only short and long-term efficacy that establishes LSVT loud as an efficacious treatment. We have had the good fortune of publishing 5 randomized control trials, which are the gold standard of evidence for any type of treatment. You can learn more. The LSVT Global website is down in the left corner, and we'll talk more about how to find treatment at the end of this slideshow, but it's really important for you to see how dramatic the changes can be that you saw in Shirley, and this is the reason that it happened. Next slide. Today, LSVT loud is considered the global standard for speech treatment for Parkinson's disease. We have over 24,000 LSVT loud certified clinicians in 70 countries, so this works globally. And when Jenny tells you about LSVT Big, we have over 22,000 LSVT Big certified clinicians in 43 countries. Next slide. So here are published outcome data. On the ordinate is sound pressure level or loudness, the vertical ordinate. The horizontal ordinate is time. So we've got pre-treatment, post-treatment, 12 and 24 months follow-up. You see blue is LSVT and red is an alternative treatment that we studied. Only patients who received LSVT loud had a significant increase, you see in the blue upward going slope, that was maintained at 24 months follow-up. So this is the very first time long-term maintenance of speech therapy effects have been documented. 2 years after 1 month of treatment, patients maintained these treatment effects for 24 months. Next slide. We now have also alternative delivery mechanisms of LSVT loud, not only because coming to speech therapy for 16 hours in a row in a month can sometimes be challenging. Trust me, you can do it, and we'll talk about ways to make that happen. But you can also receive LSVT loud by telepractice, and you can sit home and the speech clinician can beam into you and deliver sessions right into your home or your office. We also have the LSVT companion software that was funded by NIH and the Michael J. Fox Foundation, and you are able to practice half of your 16 sessions independently using that software. And let me emphasize, in both of these advances in technology, we have published data to support the efficacy of the treatment you receive when it's delivered by these alternative mechanisms. Next slide. So what do you actually do in an LSVT loud treatment session? Again, it's 16 hours in 1 month. On the left side, you see a series of what we call daily exercises. One is maximum duration of sustained vowel phonation. What that does is it stimulates a deep breath in your respiratory system, improved vocal cord closure, and improved mouth opening. For fun, let's just try one. Everybody sit up straight, take a deep breath in, and listen to what I do, and you do it. All right, take it away. Great. I believe you did it. I can't hear you, but I believe you did it. When you're in LSVT loud, you will do repeated utterances of that for approximately 15 times in a row. And the goal of therapy is to get you to have good loudness and quality with increased duration. The second exercise is called maximum fundamental frequency range. And you do a step up to a high pitch and a step down for a low pitch. Let's just try one. Go ahead and do it. Good. And then you go low. Go ahead. Very nice. And those also you do 15 repetitions each. The goal of this exercise is to stretch and thin a muscle in your larynx called the cricothyroid to help you change pitch. And you know, monotone is a very common symptom of speech disorder in Parkinson's disease. But here's the deal. These are the two fundamental foundational exercises, but the whole point of speech therapy is to improve your speech. So now we take the exercise voice and put it into what we call functional speech loudness phrases. So you come up with your speech clinician, 10 things you say every single day, like, did the mail come? Did you make the coffee? Certain things you say in your real life speech, and we put that improved loudness and quality into those phrases that you practice again and again and again. That is the first 30 minutes of a 60-minute session. Then we move over to the right side and we go through a series of what we call hierarchy exercises. We begin with structured reading, off-the-cuff questions, and we build complexity of this across the 4 weeks of treatment. What's very exciting is you get to talk about things that are really important to you in your life. People have all sorts of hobbies, and the speech clinicians love this because they get to learn about all the things you love. You can bring in recipes, pictures of the grandchildren, pictures of trips you took, books you're reading, on and on and on. But the idea is for 20 minutes, practicing your voice occurs while you talk about things that are important to you. It's important to realize the treatment also requires home practice. You do practice exercises all 30 days of an entire month, even though you have only 16 sessions of treatment, because we want you to have a well-established homework practice routine that you can and will continue on your own. Just like everything in life, if you don't use it, you'll lose it. And this is the case with exercising as well. But for 10 minutes a day of home practice, once the therapy is over, we have documented that you're able to maintain the gains that you got. There's another really important exercise that we do in therapy, which in my opinion, is probably the most important exercise because it forces you, and I use the word force because in the beginning, most patients don't want to do this because when you get people louder with Parkinson's, they think they're screaming and people won't like it. Well, you'll learn that's not the case, but the clinician assigns you what's called carryover exercises. So each day you use your loud voice in short real life situations. And the clinician will say, what are you going to do now when you leave speech therapy? And you may say, oh, I'm going to go to the bakery and get some donuts. So she will assign you, when you go order the donuts, use the louder voice that we just trained in therapy. And when you come back tomorrow, tell me how the woman or man who served you the donuts reacted. So this is essential because there's no point in having a good voice in the therapy room if you aren't using it in real life situations. I find this the most exciting part of LSVT because I get to sort of tease the patient into using the voice, and then they come in the next day and they'll say things like, oh, I used it on the phone and my grandson said, Grandma, that can't be you. I can really understand you. So you get to see the functional impact of the louder voice. These are assigned also all 30 days of the month. So this is the standard LSVT protocol that has been documented in 5 randomized controlled trials to improve speech and voice in the short and long term in Parkinson's and make a dramatic impact on your quality of life. Next slide. So now let's have Jenny tell us about LSVT Big.
Okay, hi everyone. As Dr. Ramig said in the beginning, I'm Jenny and I'm a physical therapist. I've been teaching with LSVT Global since 2011 and practicing using LSVT Big in my clinical practice since 2009. Just recently in December, transitioned over to working full-time for LSVT and leaving clinical practice after over 20 years of being in clinical practice. So new role for me here, but I'm super excited to be able to talk to you about what LSVT Big is. As for me and my clinical practice over the last 20 years, the moment I got certified in LSVT Big and was able to provide this treatment for my patients, was the moment that I felt like I was finally helping my patients with Parkinson's get better. Instead of learning adapted techniques to compensate for the deficits they were having, I actually was making my patients better and seeing that last. So I'm excited to tell you about this today. Whereas LSVT Loud is focused on that simple focus of loudness. Now we're going to talk about bigness. So Loud started first. So we were really formed off the basis of all of the research that Dr. Ramig and her team did and translated this over to movement. So for BIG, it is also a standardized therapy approach. That same prescribed dosage of 4 days a week for 4 weeks, so 16 sessions in a month. Those sessions are 60 minutes long, and you're one-on-one with your physical or occupational therapist for all of those sessions. The focus is high effort. So our therapists that are trained and LSVT BIG certified are focusing on kicking everything up a notch, right? Making patients and people work a little bit harder than we might normally work, because we know how important intensity and high effort is. If you look at the literature out there on exercise-based interventions, therapy interventions, one key thing that runs through all of them is that we need amplitude, intensity, and high effort. So we know that that is true no matter what we're doing from an exercise standpoint. So LSVT BIG is standardized, but it is also individualized. So where Dr. Ramig talked about choosing functional phrases that you say often in your day, we're going to also choose functional tasks that you do physically often in your day. So we have some things that are kind of set as a protocol, and then we adapt those to fit with what you need. And we also find out what functional things are important for you to customize your treatment. So we can adapt things to make it a little bit easier if you're someone that's really struggling. And we can also adapt things to make it harder if you're someone that's functioning pretty well, but know that you want to stave off some of these symptoms from progressing. So we really do adapt the treatment to fit with what your needs are at that moment in time. What I'm going to show you is a little before and after video. Like you guys got to see Shirley for LOUD, you're going to see Bernie now for BIG. In this video, Bernie is 71 years old. He's had Parkinson's for 14 years. He was referred to physical therapy because he was having some issues with slowness, difficulty walking, falls, and some freezing. His medications were optimized before starting treatment, which means there was no change in medications from pre to post. And just like in the Shirley video, you're going to see him on his evaluation day, and then you're going to see him at the end of his 4 weeks of treatment. So you're going to see change that happened in just 4 weeks' time. He completed that 1 month of the intensive LSVT BIG protocol. So there's no sound in this video. What you're going to see on one side of your screen is him walking before treatment, and on the other side, you're going to see him after. It's pretty easy to know the difference because in the before, he's using a cane, and the after, he's gotten rid of the cane. So I'll talk you through this a little bit as we watch together. So here's Bernie walking in the same hallway on the left before treatment, on the right after his treatment, after his 4 weeks. So you can see obviously on the right, he already made it through the door. He has no cane. On the left, you can see him starting to hesitate and freeze a little bit, trying to walk through that space with the rugs, which we all know flooring changes. If you suffer with freezing, flooring changes can be a nightmare. So on the left, he's finally gotten through that doorway. On the right, he's all the way out in the parking lot. And notice just the change in his stride, the step length, the change in his arm swing, his confidence. I mean, his speed is pretty obvious. On the right, he's decided to walk right past his car and turn around and come back. Where on the left, he still hasn't quite made it to his car. So if we want to talk about that video, he met all of his goals for treatment. By the time treatment was done, he was doing all the things he had set with his goals. He was no longer using a cane. He was no longer falling. He hadn't had any falls in 1 month's time since treatment started. And he was actively practicing his exercises at home. So in LSVT BIG, our target is bigness. In LSVT LOUD, it's loudness. What's the same between the two is it's a focus on amplitude. So it's an amplitude of voice, and it's an amplitude with movement and bigness. Our mode of delivery for both treatment protocols is that it's intensive and with high effort. So the reason I tell my patients there's a method to the madness. There's a reason why we see you 4 times a week for 4 weeks. Research has shown, and the principles of neuroplasticity have shown, that if you want to get better at something, you have to do it over and over and over again. So we've built that into the treatment protocol, where it is intensive with high effort by the number of days per week you come, the number of repetitions you do every time you're there. And then the icing on the cake is the number of practice of repetition that you get at home. So you're practicing these activities and movements or your voice exercises hundreds to thousands of times within that month. And then our goal is calibration. Like Lori said, that how many people will say, my voice isn't too soft, you need a hearing aid. That's that mismatch of calibration, right? Where you think your voice is as loud as it should be, but what actually comes out is not that. So your friends and family aren't making that up. It truly is a mismatch between what feels right to you and what actually is produced. So she used the example with voice. What I hear a lot with movement is that I'm not walking too slow, you're walking too fast. So truly that is that mismatch where the person with Parkinson's feels like they're using the right amount of effort and feels like they're moving like they should be. But if you ask the people around you for feedback, they'll say, no, I've noticed you've slowed down. You're not walking as fast as you used to. Maybe it's you're not swinging your arms when you walk. So it's a part of the disease and the diagnosis. And I always tell my patients, don't feel bad about getting that feedback, because the only way you can try to fix something or try to make something better is if you know about it. So if you're not aware that the deficits exist, why would you try to fix them? So our goal with calibration is to identify the deficits where things are too small, too soft, too slow, and try to bring them back up to normal with treatment to achieve more normal voice, more normal movement throughout your day. So through the cues of big and loud, we're cueing bigness, we're cueing loudness, but our end goal is that you return to normal. So that's always our focus with treatment. So this slide just talks a little bit more about that mismatch between your perception and how other people perceive you. And in my job, when I ask people to walk bigger or swing their arms bigger, they will say, I can't walk like this. People will think I'm crazy. It feels wrong to you because your body has adjusted to getting used to this smaller movement pattern. And when you're cued to move bigger, it feels strange. Will it always feel that way? No. Our goal in treatment is that it starts to feel normal again. So it won't always feel that way, but you do have to put your trust in your therapist for a while that we're leading you down the right path to finding that normalcy. Sometimes we'll videotape you to take a look at that, and so that you can actually see what you look like when you walk. I always say a picture's worth 1,000 words. So as Dr. Ramig shared with you her treatment session slide for an LSVT loud session, this is what an LSVT big session looks like. So voice moves in a lot of different directions. Our bodies move in a lot of different directions. So the exercises were developed to really encompass all the planes and directions that we move on a day-to-day basis. So we have 7 exercises that we do, 8 to 10 reps of each of these exercises. And we're going to have an opportunity to practice a couple of them shortly here. We also practice with big walking. We choose 5 functional component tasks to work on. So this is similar to your functional phrases or, in your voice treatment. One of them is always going to be sit to stand. So standing up out of a chair, and we'll practice that today together as well if you'd like to practice with me. And then we pick other functional tasks that are important to you. So you might say, I'm having trouble getting my cell phone out of my pocket, or I'm having difficulty taking a backward step when I open a door. So we'll have a conversation about the things that you've noticed you're struggling with. And it doesn't necessarily have to be things that you no longer can do. It maybe is just something that you've been frustrated with. I'm slower at it. I'm clumsier at it. I'm not as efficient as I used to be. And I don't want this to get worse. I want to make sure I can keep doing the things I want to do. Those are simple one-step tasks. Then we go on to some hierarchy exercises where we pick multi-step tasks. Might be the process of getting in and out of the car to go shopping, playing a game of golf, a game of tennis. Maybe it's just getting dressed. Any of those daily activities that you do, and practicing those things, breaking them down to smaller units of practice initially, and then building it up with more complexity. So we identify anywhere from 1 to 3 more complex multi-step activities that we want to work on. And just like Dr. Ramig said, there's homework. Everything you're doing in your treatment session, you're gonna practice at home as well. And we give carryover assignments too, just like she mentioned. So every day we're giving a carryover assignment. We're asking you what you're doing that day, and we're fitting something into your plan for that day as a way that you can practice your big movements. Okay, so now you're welcome to practice with me. If you don't want to, you certainly don't have to, but I'm going to demonstrate a couple of the exercises so you get a sense for what they are like and how a therapist would instruct you to do them. You are welcome to join me. The first one we're going to do is from sitting down. So I'm going to back up a little bit so you can see all of me. And if you're going to practice with me, just make sure that you have enough room that you can kind of reach out with your wingspan and not knock anything over. So let me see how my camera is here. Oh, I think I'm pretty good. Okay, if you're practicing with me, you're gonna sit with your nice, big, tall posture. So I kind of want you towards like the front of your chair, sitting with that nice, big, tall posture. Then with your legs, you're gonna step out nice and big and wide, okay? So that start point is big posture throughout your whole body. I want your chest up, your shoulders back, sitting tall, legs are big. Now, for anyone who's practicing with me, just watch me on the first one. Don't do it with me, just simply watch. This is the first exercise. It's called floor to ceiling. So it's a big forward reach with big hands and big fingers. Then we're going down to the floor big, or as close as you can get. Then we're going all the way up to the ceiling big, and then out to the side big. And right here, we're gonna hold for a count of 10. Hands are open big, posture is big. And when we get to the end of our count of 10, we're gonna come back with a slap to the legs. So a strong finish. So hopefully you notice every movement has a distinct start and a distinct stop. So we don't want any like ballerina smooth movements. We're really looking for crisp, clean, high amplitude movements. All right, so those of you that are going to practice with me, let's try some together. So with your big posture, you're going to reach forward big. Good, big hands, big fingers, stretch them out. Good, and then to the floor big, and then up to the ceiling big, and then back big. And we're gonna hold. Fingers are big, hands are open. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Finish it. Nice. We're doing one more. Here we go. Big reach forward, big hands, down to the floor big, up big, back big, and we're holding. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, big finish. So you would do 8 repetitions of those. Quite honestly, I kind of make all my patients do 10, but that's just me kicking it up a notch. All the research was based on 8 repetitions of that exercise. You go on to do those. There's one more exercise in sitting beyond that. Then we move up to our feet. So I'm going to get my chair out of the way, and I'm going to demo an exercise in standing for you. Now, if you are practicing along with me and you have any balance concerns, you can always keep a chair right on your side, and you can practice the same thing that I'm going to do, just with one hand on your chair. And if you're really concerned about your balance, maybe better that you just watch and not participate. But step forward and reach is the first standing exercise we do. So with all the standing exercises, you're standing with your feet about hip width distance or shoulder width distance apart. Parkinson's, as it progresses, will narrow your base of support naturally. So you have a tendency to want to keep your feet closer together than they should be. So in all the exercises, we're really keeping that nice big base of support, big tall posture, and again, big open hands. Now, if you're practicing with me, just watch me on the first one. You're gonna do a big step forward, big arms out, and then you come back and you finish big. And when I mean a big step forward, I don't mean that you're taking a lunge step and falling, getting out of balance. What I mean is you're really picking that foot up and putting it back down strong on the floor. So that's really more what that big step means. Okay, if you're practicing with me, here we go. We're gonna start with our big hands, our big posture. We're gonna do a big step forward and a big step back. So you'll notice there's no hold time with this one. It's just stepping out and stepping back. Let's try one more. Big step forward and big step back. Good. Now take a look at your feet. Did you get them back to the same spot you started from? That's something we're watching too, is for accuracy of amplitude with your movement. We're going to do the other side. So same thing, big tall posture, big step forward, and big step back. And we'll do one more. Big step forward and big step back. Okay? So that is one of 5 standing exercises. We go forward, we do a sideways one. We also do a backwards. And then we have a couple of rocking exercises. So we're going to try one of the rocking exercises together. This one, you stand with a wide staggered stance. So 1 foot out in front, 1 foot in back. This one is more of a smooth motion of transitioning weight shift. So weight shifting forward, weight shifting back. And then we throw our arm swing into it. So if you're practicing with me, 1 foot out front, 1 foot in back, nice wide base of support. And then we're gonna rock forward with a big reach, and we're gonna rock back with a big reach. So notice I'm going from my back is up on my toes to my front foot is up on my heel. So it's like you're a rocking chair, rocking back and forth. We do this for anywhere from 10 to 20 repetitions, and then we come back and finish big. If you're practicing with me, you got to keep it even, switch sides, put the other foot out there. Same thing on the other side. We do a rock, a reach, a rock, a reach, and again, 10 to 20, and then a big finish. Okay? So that just gives you a little sample of a few of those exercises. And while I'm away, I'm also going to show you a quick sit to stand. So one of the functional tasks we always work on is standing up out of a chair, because many of you probably know that that can be problematic. This is what our sit to stand exercise looks like. It's a big reach forward, a big stand, and then we do a big reach forward to sit back down. So anyone who wants to practice with me, you're welcome to practice. Let's just do a couple of them together. We would normally do at least 5. All right, here we go. Big reach, big stand, big reach, and sit. Good, one more. Big reach, big stand, big reach, and sit. Perfect. So we would do at least 5. Again, I make most of my people do 10. I like to kick it up a little bit higher with that, with my outpatient practice. But we would do at least 5 every day. You'd also practice it at home. Okay. So that was talking about that functional task, how your sit to stand would always be one of them. We pick other functional tasks that are important to you and have you complete those as well. We also want to talk about the idea that exercise is medicine. So after treatment, you need to make sure to continue to take your daily dose of medicine, which would be your LSVT exercises. So you don't just get to be done when your 4 weeks are done. You're going to continue to do your exercises, whether it's your LSVT loud voice exercises or your LSVT big, or both. If you've been through both treatments, you're going to continue to do those once a day, every day, forever. So that is one of the really important pieces, is to keep it going. I always like to tell my patients that if you're someone that takes Cinemet or a different version of carbidopa, levodopa, you know that if you don't take it, it doesn't work. Just like exercise, if you don't do it, it doesn't work. So what's the research on LSVT big? I'm just going to share one quick article with you. There are many, but this is one of my favorites. So this was the first randomized controlled trial that was done, and it was done in Berlin, Germany, or just outside of Berlin, which is why it's called Comparing Exercise in Parkinson's Disease, the Berlin LSVT BIG study. What they did is they took 60 people with Parkinson's disease. 20 of them did LSVT BIG, 20 did Nordic walking, which is that pole walking, if you guys are familiar with that. And that was a very popular treatment for Parkinson's at this time in Germany. And 20 did home exercise practice. All three groups had the same amount of therapy intervention. They all were seen for 16 treatment sessions. And they were followed for out their 4 weeks of treatment. And then they had a follow-up 4 months from the start later, so 16 weeks later. Notice one little thing is that the people that did LSVT BIG and the people that did home exercise were seen 4 times a week for 4 weeks. The people that did Nordic walking were seen twice a week for 8 weeks. I got a chance to ask Dr. Ebersbach why that was different. And he said really because they were comparing what they were doing normally, what they were prescribing normally for Nordic walking to this treatment. And normally a doctor at that time was prescribing twice a week. So that was why they did a little bit different of a look there. I'll orient you a little bit to the screen. This is based on the UPDRS, which is a test that maybe your neurologist has done with you. You might not even be aware that they ran you through it or what the name was. But a lower score is a better score on this test. So if you're looking at this, the straight line is the people that did the home exercise program instruction. The tiny dotted line is the people that did the Nordic walking. And then the wide slashes are the people that did LSVT BIG. And what is striking to me about this study is that the only people that got better, and better is a lower score, was the LSVT BIG group. They improved out through 4 weeks of treatment. At week 4, treatment ended. And if you notice, they continued to get better all on their own, even after treatment was over. Now, when they look at new drugs to use for Parkinson's disease, they're looking at a 5-point drop or more in the UPDRS scale to indicate that it moves forward with clinical trials. What Dr. Ebersbach said was most important to him as a neurologist from this test or this research study was that we saw an over a 5-point drop with exercise alone. So that is a very impressionable thing to know that exercise is as good in many cases as medicine and can be used as medicine. So making a plan, if you're interested in getting speech, physical or occupational therapy, definitely do it. It is so important and so valuable. Parkinson's is complex. Your therapist will help you to restore and optimize your function. They'll teach you exactly what to do, not only during treatment, but how to sustain after treatment. They can also help advise you on the best community-based exercise options to get involved with. They can teach you how to use your louder voice and your bigger movements in daily life, and how to make a plan to keep talking loud and moving well for years to come. So we like to say that start as soon as possible, as soon as you can get started, but it's never too late. So don't be hard on yourself if you didn't start right away. It's never too late to jump in and get started. If you are interested in pursuing LSVT Loud or LSVT Big or both, we do have a nice tool on our website that you can use to help find therapists in your area. It's that red button in the upper corner there that says find LSVT clinicians. If you click on there, you're able to put in your area, your zip code, and search within a radius to see who's around you. If you struggle and can't figure things out and it's hard to do, our staff in our office can also help. If you send us an email, we can take a look and see if we can help you as well. For therapy, in most situations, you do need a prescription or a doctor's referral. For speech, if you're going to do LSVT Loud, and for physical or occupational therapy, if you're going to do LSVT Big, your order does not have to say LSVT Loud or LSVT Big on it. It simply can be speech eval and treat or physical or occupational therapy eval and treat. But it is helpful if it does say LSVT on there, so they make sure they match you up with a clinician that is certified and able to provide that treatment. Also, we have tons of opportunities to learn more. Our website is full of information. There are live and on-demand webinars. We do blog posts, testimonials, videos. We share any new research articles. We have a lot of resources. We're also on many social media pages. So if you're interested in learning more, head to our website, take a look, read the blogs, see what other additional information we have there. So I'm going to go past the, whoops, maybe I didn't get the Project Euphonia slide in here, Lori. How did I miss that? So Lori, do you want to talk about Project Euphonia quick?
Yes. Do you think you can find that slide?
Yeah, let me stop share and see if I can get that for us.
Okay, that would be great. So you heard exciting, invigorating information about LSVT Loud and LSVT Big, and we will answer your questions you have. Furthermore, you can email us afterward to get more information, because these are really life-changing treatments, and it really will help you with quality of life in Parkinson's. What I want to mention right now is a project that LSVT and other organizations are doing with Google. And the rationale for this project is that when we use automatic speech recognition systems, like you call someone and you don't talk to a person, but you talk to an automatic system, it's even hard for me if my voice is hoarse to make them understand me. It's very hard for people who have speech disorders to be heard and understood. And I'm sure you've had frustrating experiences with Alexa or Siri, etc. So Google is taking on the project of training their automatic speech recognition systems to understand disordered speech. And in order to do that, we need to send them samples of speakers with disorders. So we've been working with them, as well have other organizations, for about 2 years, having patients just simply sit at your computer and read short phrases into their software. You don't need to download anything. It's a very straightforward project, and it's very exciting. You get $60, and you usually can finish the project within maybe 2 hours, but you don't have to do 2 continuous hours. You can do a half an hour one day across a week and finish. It's so exciting because they're getting some really good results, and they're going to come up with a way to implement this a bit into training. And so on this flyer that hopefully Jenny can pull up, you can see the flyer. I can also send it to Sharon, and she can forward it to you, and it shows you how to register for this. And the exciting part is you get to be mentored by an excellent speech clinician when you do this. So they will bring you in, be certain you have the right, you can either record on your home computer or on your handheld device, etc., and set you up and train you on this chit chat, and then you just do it. And it's really fun. Patients have enjoyed it, and I'm encouraging you to get on board with it, because we want to make certain that Parkinson's disease is well represented. They're also studying ALS, stroke patients, ataxia, etc., but we want to be sure the Parkinson community is well represented. So I guess you can't find that, Jenny, right?
Well, I don't know what happened to it. It is in their slides that they got.
It is?
Oh, yeah.
It's not on your slides.
I don't know where it went on my slides. Yeah. So
I can also send a copy to Sharon, because sometimes when it's in a PDF of slides, there's not a direct link to the QR code or the link. And if you get the direct link, you can just go right to the registration page, get some more information, and be in the system. So, and since it's Parkinson's month in April, it's a good time to give your voice to Google. We would love it. So now, if you guys have any questions for us, there was a question from Victoria, and I think it was that you felt your voice was too soft, and you went, I'm thinking you went to a speech clinician and they said you were fine. Is that what you were asking? Did I interpret that correctly? Well, let's
Hello?
say that's what you were asking. The one thing that happens with Parkinson's is sometimes, well, first of all, did you go to a clinician who is certified in LSVT loud? Yes, so it was, can you unmute your mic, Victoria?
There. Okay, yes.
So you did go to a clinician who's been trained and certified in LSVT loud.
Correct,
Okay,
right.
good. Good. Sometimes what happens is because people with Parkinson disease have the potential to get louder, you may go to the treatment or to the assessment and you're performing a little bit, you're sounding better when you're sitting with the clinician than when you are when you're home. Because when you're home, there's distractions, there's background noise, you have to think of things, whereas with the clinician, it's in a quiet room and you're performing. And this historically has been a challenge when patients go to neurologists because the exact same thing happens. You're in a quiet room and the neurologist says, do you have a speech problem? And of course, people think they don't, so they'll say no. And the neurologist thinks you sound good. And, you know, if the spouse is there, you can always ask the spouse and get more of the real story, but that could be what happened. But I would say when maybe the speech clinician wasn't trained relatively recently, because we always tell speech clinicians to be aware of this. And if you come in complaining about a negative functional impact on your speech outside and the clinician thinks you're really fine, I will say point blank, she's wrong. It's really, I'm assuming it's a she, could be a he.
Yeah.
It's if you complain, the sooner you get working on your speech, the better. So it's, oh, there it is, yay. Okay, so it's possible that that's what happened. And we always encourage our patients to really speak up and say, I have a hard time having people understand me, and maybe now you think I sound good, but I don't, and I need help. And if they still say you're good, I would find another speech clinician, because that person isn't really paying attention to your need.
Yeah.
Does that answer your question?
Well, it's sort of, because I'm the one that, since I was just barely, she said I barely qualified, I thought, well, I'll just wait on it.
No, don't wait. That would, no, because the sooner you work on anything in life, we know this, you know, no matter what we're working on, the sooner we work on it, the better. And so I would strongly encourage you to do that, because then you don't deteriorate. And it's much easier to keep your speech strong and have good voice than to let it go down and then have to pull it out of the mud, so to speak. It's much harder. And then you've got the time period in there where people can't understand you. And that's very frustrating for you, I know.
Yeah,
And for,
okay, very good.
yeah.
Very good, thank you. Yes,
Thank you.
yes.
Okay. Lori and Jenny, thank you. Thank you so much. This was terrific. I want to stop sharing your screen. And if you have any questions about Project Euphonia, Lori actually did a presentation in December. You can find that on the website.
And I'll also put my email in the chat so people can email me directly too.
And
Okay.
before I stop sharing my screen, since this wasn't up before, there is a QR code in the corner. If anyone wants to scan that with a cell phone to actually get the direct link, feel free to take a moment to do that before I stop sharing, because that will take you right to their site as well.
All right, then I'm going to leave it up for a second. While we leave that up, I just have a few things I want to go over. First of all, thank you to both of you. We're giving both of you a virtual tiara as a thank you.
I love it.
Yeah. So thank you, thank you, thank you. Upcoming programs, I need to get back to my slides. So I think.
All right, I will stop sharing right now then. Hopefully everyone got a chance. So there we go.
Great.
Okay.
Thank you, Jenny.
Yeah.
Okay, so today's the last day for our big birthday celebration fundraiser. Since tomorrow is World Parkinson's Day, we're going to end today. So if you haven't, for those of you who've donated, thank you, thank you, thank you. We really appreciate it. If you're interested in making a donation, any amount is, nothing is too small. You can text Twitchy to 707070. Next slide. And we did the virtual tiara. And we got a lot of response. A lot of people are interested in a retreat. A lot of people are interested in attending the World Parkinson's Congress in Barcelona next year, which is really exciting. And part of the money we are raising is going towards scholarships for first-timers who are going to the conference. Scholarship will cover their registration fee. And we have several people who have brought up they are interested in a chat group for women without partners. And I'm collecting names, and if I get enough people, we will start something similar to the group that's on Tuesday mornings that Shelley and Dar run. Next slide. So next, in 2 weeks, we have Dr. Zindu Subramanian and Adrian Keener will be talking about their study on the unmet needs of women with Parkinson's disease. And this should be very, very interesting. When you should have the link to the study. You can read it before the session and ask whatever questions you want. And then in May, I'm not quite sure what's going on. It's Mother's Day. We're not going to do a program on Mother's Day. I can't do the next week. We may only have one program in May because of various things. And let's see, next. We still have the Open Mic Tuesdays, which are going strong. Shelley and Darlene, thank you so much for doing that one. That's great. And I'm going to a quick poll. There's just 5 quick questions about what we're doing and is it working. And just take your time, take a look at it. We want to know how many times a month you want to have Twitchy Women programs, because I find that people are coming on the weeks we don't have a program, looking for something, and maybe we can fill in with chat sessions or something else. So go ahead and answer the questions if you can. Let's see. I'll let it go for a minute.
Yeah, and while you're answering your questions too, if I can just make a plug for one more thing too. Tomorrow is World Parkinson's Day, and we have an initiative going on around the world to try to do as many sit to stands in one day in honor of people living with Parkinson's disease. So Block Steady Boxing and LSVT Global are both promoting it in the United States. You can sign up through our website by going to our blog, to the link there to sign up, and just logging as many times you stand up and sit down during tomorrow to try to honor the 1 million people living with Parkinson's disease in the United States. So if anyone wants to jump into that and get involved, it's not too late to sign up.
Okay, and we are getting answers to our poll. Let's see how many more answers we get. We got 6 out of 22. We'll wait till we get a little bit higher percentage. I also wanted to say, well, the sit to stands, I'm doing them one-armed because I'm still recovering from my injury. But a lot of the exercises that you saw demonstrated have been adapted by other programs like Rock City Boxing, Power Moves, etc. You see the same big movements in a lot of programs. So my real quick question to you while we're waiting for the poll is, once you finish your 16 weeks and you go into something else like Power Moves or Rock Steady, is that will help maintain the gains that you made?
So you will actually, once you're done with your 4 weeks of treatment, you will actually continue with the exercises from the LSVT Big program or the LSVT Loud program. So sit to stands are part of your exercise program. So you would continue with those exercises on a daily basis, even once you're done with therapy. And certainly there's a lot of different types of exercise we do that requires us to stand up. So you'll find it in other things too, but it is also a part of the homework program for this protocol too.
And also there are really nice follow-up groups now, virtually done, both for LSVT Big and LSVT Loud. So there is a bit of a silver lining with COVID where we've discovered the fact we can do a lot of these things virtually. And so both LSVT Loud and LSVT Big have once a week online follow-up groups for patients to continue to practice the exercises they did during therapy. And patients really love those. Jenny, you might mention, because I know you're one of the leaders.
Yeah, we teach those on Mondays and Fridays. Right now, we're kind of in a beta practice with those, and we will be going to a platform, a subscription platform here this summer that will give you access to not only those classes, but a variety of other recorded classes, resources, homework helper videos, all of those kinds of things. So more to come. It's one of our initiatives that we're getting launched here in the next few months.
Okay. All right. Just real quickly, most people would like a program once a month, which would be great for me. There's that one person who responded every week. Let's talk. So we will continue once or twice a month, especially during the summer. Everybody gets so busy. I noticed a big drop off last summer because people were getting out again, which was the whole goal of this, was to get you through the worst of the pandemic, so that when we do get out, we don't have to meet as frequently. And we may start doing some hybrid programs where we have actually some of us meet in one place and then bring everybody else into Zoom. Let's see, continue with the programs we have, exercise demos, etc., panel discussions, glad you like that. And if you're willing to host, just put it in the chat who you are, because I would love to get in touch with you. And, you know, most of you are in the U.S. We have one person from the UK today. I'm not sure who's here from the UK. Welcome. Usually we get several, but I don't know how many. We only have 8 who responded to these. So anyway, I'm going to stop sharing that. Our next slide. Let's see. Let's turn that off. Okay, so that's the end of it. I'm going to stop the formal program here. I want to thank Lori and Jenny for their wonderful, wonderful presentation. And if you want to stay on and answer a few questions with those women who want to chat for a few minutes, we'd love to have you.
Sure.
And that's about it. So
thank you for inviting us, and thank you for attending. It's wonderful to meet you and see you all. And we're happy to answer any questions you might have at this time.